Welcome to this podcast, which is going to discuss the concept of ethics in medicine and healthcare. This is available on YouTube, to which you can add your own closed captions. It's also available as a PowerPoint presentation. If you want to discuss any of the issues in this presentation or have any questions, please feel free to contact me. So what's this podcast about? Well, it's about the concept of ethics and ethical behaviour and some examples of when ethics have gone wrong in the past. I've picked some of the more interesting examples from the past 100 years. There are some quite upsetting stories and some potentially disturbing images, so if that's going to affect you, please let me know before you watch the presentation. We hear the word ethics all the time in everyday conversation, but we need to have an understanding of what ethics is and what the foundational principles of ethics are. And we also need to discuss what happens when things go wrong ethically. Ethics is a selection of moral principles really that govern how we live our lives and how we act. In healthcare and medicine, there are 4 guiding principles of ethics, and I've listed them here, and they are autonomy, beneficence, non-maleficence, and justice. And in the next slide, I'm going to talk about what they mean. Autonomy means that you're in control of your own destiny and decisions. So patients can make their own choices depending on their own values and beliefs, even though it may clash with what we believe is the right thing to do. Beneficence means that we ought to not do harm and promote good. Non-maleficence is similar, or non-maleficence rather, and it's about the process of not causing harm, not making things worse really. And justice is the concept that we should treat everyone equally and fairly. At the end of this presentation, I'm going to present you with an ethical issue, and I want you to think about whether you would give ethical approval or not if you were presented with this issue. We're starting our journey in the 19th century in Edinburgh in Scotland, and 2 infamous people from history, Burke and Hare, who were 2 people who provided bodies to the medical schools in Scotland, and they realised that they were being paid quite well for this, and it didn't take them too long to realise that the best way to get a fresh body was to kill someone and present the body to the medical school for dissection, and they were paid for each body that they provided. Over a period of 10 months, they killed 16 people and sold the bodies to a pathologist called Dr. Robert Knox. Their scheme was exposed, and one of them testified against the other and was granted immunity, and Burke was found guilty and executed by hanging. He was then, ironically, publicly dissected, and his skeleton is still on display in Edinburgh. And gruesomely, a book was made from his skin, which doesn't sound particularly ethical to me. It seems rather unfair that one of them was punished and one of them wasn't, and also that the doctor involved was never prosecuted, because there was no proof that he knew that the corpses that he bought were murder victims. And here is the skeleton of one of them. We're going to fast forward now to the 20th century, and one of the big scandals there was the MMR scandal. This was a single injection that was given to babies. MMR stands for Measles, Mumps and Rubella. So we're going to talk about what those diseases are first of all. Measles is a very contagious infectious disease caused by a virus, which can cause high fever, high temperature and a cough, and then white or red spots can form inside the mouth and on the skin. It can be quite serious. The rash itself is not too big a problem, but there are complications, and it may include severe diarrhea or pneumonia, and it can be fatal. Mumps is also known as epidemic parotitis. It's an inflammation of the parotid salivary glands. This can cause severe swallowing difficulties, and it can close the airways in severe cases. It can also cause meningitis, deafness, and result in infertility. Rubella is also perhaps better known as German measles. This is a viral infection that can cause enlarged lymph nodes. That's called lymphadenopathy. It can result in fever, sore throat, and again it can include complications such as testicular swelling or miscarriage in pregnant women. What happened was that in 1998 The Lancet published a paper that claimed that autism was linked to children who'd had the combined MMR vaccine. Now, babies are traditionally given one injection against these three diseases. The problem with a lot of things in medicine, if the press get hold of it, they can sensationalize it, so you have to be very careful when you listen to any medical stories in the press or the media, because it sells newspapers and gets viewers. The guy that did the study was a chap called Andrew Wakefield, and he committed numerous ethical violations, one of which was multiple undeclared conflicts of interest, which we'll talk about. He manipulated the data, and he broke some other ethical codes as well. Even though The Lancet is a highly respected peer-reviewed journal, it just goes to show that just because it's peer-reviewed doesn't mean it's accurate. The article was retracted eventually. The article was found to be utterly false, and the journal claimed that it had been deceived in the publication of this document. Andrew Wakefield was found guilty by the GMC, or the General Medical Council, of serious professional misconduct in May 2010 and was struck off, which means that he can't practice as a doctor in the UK. In 2011, more information came to light which suggested that the paper was even worse than originally thought. Quite incredibly, he had taken money from solicitors who were hoping to bring cases against people who'd had the vaccine, who were alleging that the MMR triggered autism in children. He'd also lodged a patent for a new vaccine against measles called transfer factor, which he claimed could also treat inflammatory bowel disease. He actually tried out this therapy on one of the children in his trial and didn't tell the GP. He actually took blood from children at a birthday party of one of his old children and paid them £5 a time to do it, and failed to register any conflicts of interest in the research. I think perhaps the saddest part of this story is that if you have a child with autism, it's understandable that you're going to want to look for someone to blame. And if this doctor announces that this injection has caused your child to be autistic, it's fully understandable that you're going to latch on to that. So Wakefield gathered quite a strong following of parents of children with autism, and he still has this to this day. He can't work as a doctor in the UK, but I believe that he is working as a scientist in the USA. I remember when this was happening, and every day outside the High Court there were huge groups of people, parents of children with autism, who were on the side of Andrew Wakefield. Since the Wakefield study, there have been numerous much larger studies which now show that there is no link between the MMR vaccine and autism, and that the benefits of the vaccine greatly outweigh the risks. But the damage was done. Many parents decided not to take their children for immunisation, and it's possible that some children got serious complications or even died because they weren't immunised. This is Andrew Wakefield, who still protests his innocence, but basically the whole MMR saga has been branded as one of the most damaging medical hoaxes of the past 100 years, and it's replete with examples of poor ethical behaviour. He was actually charged with 50 counts of dishonesty, including taking money, fraudulent research. I think one of the things that he did was he altered the data but didn't tell his co-researchers and then submitted the article. So his co-authors were on a research paper that they hadn't approved, which is obviously not good. He also did some relatively high-risk procedures on children without ethical approval, lumbar punctures for example, and he was shown to just have a callous disregard for the distress and the pain that he was in return giving these children £5 to. So that shows quite a staggering breach of ethics on numerous levels, really. Another quite distressing ethical problem in research was the Tuskegee syphilis experiment. So between 1932 and 1972, which is a long time, decades, there was a study done in America to see what happened to people who were infected with syphilis, and they chose African American males in Alabama. They were told that they were receiving free health care from the US government, and they enrolled 600 poor black men and took them into the study. The men were offered free medical care and meals and free burial insurance, which, if you're in a deprived situation, is a big carrot to give to somebody. None of the men that were infected were ever told that they had syphilis. And the problem here is that partway through the trial, antibiotics were developed, and they decided not to reveal this to the patients. The men in question were just told that they had bad blood, which is obviously deceptive. The biggest issue was that penicillin arrived halfway through the study. So what should have happened is that the study should have been stopped and the patients treated appropriately and cured of syphilis, but they weren't. In 1972, a whistleblower, that's a person that comes forward and says, look, this is happening, this is wrong, led to changes in US law and a much tighter protection of people in clinical studies. So we now require informed consent, communication at every stage, and an accurate reporting of test results at every stage. And another problem is that syphilis is contagious, so of the men who died of syphilis, that was obviously an issue, 40 of their wives also got syphilis, and it's also possible for a pregnant mother to pass on syphilis to an unborn child, which is called congenital syphilis. We're coming back to Europe now, and in the 1950s a drug called thalidomide was given to ease morning sickness in pregnant women. It became actually available to buy over the counter in some countries, and one of the problems with thalidomide is that it caused birth defects. It caused children to be born without limbs or partial limbs, or caused the mothers to miscarry. About 10,000 cases were reported, and interestingly enough, at the moment on the news there's a similar case. There's a drug called Primodos, which is another pregnancy related drug, which seems to be doing something similar. This is a picture of a little boy born with the effects of thalidomide, and you can see he's got what's called phocomelia. He doesn't have any arms, or he may just have very primitive limb buds. We now go to Asia, to Japan specifically, and in the 1980s, between 1,000 and 2,000 people with haemophilia contracted HIV via blood transfusions, which hadn't been treated appropriately, or the donors hadn't been screened for HIV. Haemophilia is a condition where people don't produce the right clotting factors, and obviously they bleed very easily and they don't stop bleeding, so they quite often need a blood transfusion. Because of the ethical problems here, some high-ranking officials in the Ministry of Health and in the manufacturing industry and a leading doctor in the project were charged with involuntary manslaughter because of their omission to undertake proper ethical considerations. One that you may not have heard of, in 2007 in Panama, some cough syrup was imported into the country, which instead of having glycerine, which is a smooth, slippery substance which relieves sore throats basically, they used diethylene glycol, which is antifreeze. It's less expensive than glycerine, and it obviously is not good. It's what you put in cars to stop them freezing, and it can clog up the kidneys, and it can be fatal. 365 deaths were reported due to this, and the problem was a mix-up here where the substance at the docks was labelled TD glycerine, which means glycerine substitute. And as with most things in life, it seems that money was the driving force, and a Spanish middleman filling in a customs form changed the name to glycerine, thinking that it would be cheaper. There are some quite interesting celebrity cases of dodgy health ethics. This is Michael Jackson, fantastic artist, saw him in concert, really good. The problem with Michael Jackson, one of the problems, was that he filmed a Pepsi commercial in the 80s, and a pyrotechnic went off and his hair caught on fire, and he got some quite severe burns. So at that point he became addicted to opioids and painkillers, and that got worse and worse and worse, and it got to the point where he needed the drugs to wake up and go to sleep. Later on in his life he had major debts. He'd made a lot of payments to alleged children and parents of children and court fees, and he was in debt by about £500 million, I believe. So he was going to go into a series of concerts in London, and he employed a private doctor who he paid $150,000 a month to regulate his sleep and health. And this doctor was giving him propofol. Propofol is pretty much the strongest knockout that you can get. It's what they give you to put you to sleep in theatre. And because of an error in judgment or dosages, Michael Jackson actually died. Closer to home, you've probably heard about the Mid-Staffordshire inquiry. In 2008, it appeared that there were unusually high mortality rates in people in some hospitals in Mid-Staffordshire, which is in the central part of the UK. Some of the errors here were really upsetting. There were patients that weren't being cared for, patients that weren't being fed, patients that weren't being given drink. I think there was a case of a patient who was having to drink the water from a vase of flowers because they couldn't get hold of a drink. Pretty awful stuff. And a report was released which severely criticised the trust's management and systemic inadequacies, really. There were some major apologies, and one of the things that came out of this, which if you can see it as an advantage, was that hospitals now publish league tables of their mortality and morbidity. I don't want to comment on this slide, but I'd just like you to read this for a few seconds, please. And the same comment for this slide. Now we go to France in the 1990s, and there was an ethical scandal called the Implant Prothèse scandal, or the PIP scandal. This is a company that made breast implants. Now, breast implants traditionally are made of saline or silicone, but the silicone that's used is a very particular grade of medical silicone. This company were using industrial silicone, the type of silicone that you would probably use to seal your bath in your bathroom or your sink. These were sold and used because they were cheap, but they were found to have a 500% higher risk of rupture and leakage, and they caused some deaths in people, and it is possible that they did induce some cases of breast cancer, although that's difficult to prove. The company recalled the product, but by that time the company was bankrupt. And what happened here was that the women that had these implants, the casing ruptured and the silicone got into the body. It caused immune disorders and it blocked the lymph nodes. And I thought this was quite a powerful graphic to illustrate the ethical scandal of the PIP problem. Alder Hey is an excellent children's hospital in Liverpool in the northwest of England, but there was an issue back in the 1980s where a pathologist was taking microscopic or small tissue samples from deceased children and babies, and he was found to have contained in his storage unit or office more than 2,000 pots with various pieces of tissue from deceased children and babies. In itself, that's not an issue, because if you have parental permission to do that, that wouldn't be too bad, but he didn't have permission to do this. And you can put yourself in the position of a parent who finds out later that your child has been buried without some of its body parts, and that was going to be quite distressing. Eventually, the pathologist in question wasn't prosecuted, I believe, because there was no guarantee that they could link the particular microscope samples to a particular child. And in criminal law, the burden of proof is to find proof beyond a reasonable doubt. In civil court, it's a preponderance of the evidence, so more than 50% likely. But in a criminal case, it's beyond a reasonable doubt, and they just couldn't establish the reasonable doubt. Again, you have to hope that something positive comes from these tragedies. So in this case, the Human Tissue Act 2004 overhauled how we look after body parts and samples, and the Human Tissue Authority was created, and he was banned from practicing medicine in the UK. Another ethical scandal quite recent was Dr. Ian Patterson, who was a surgeon who was doing breast tumor surgery and other surgeries that was pointless, or he had obscure motives, or he was trying to earn extra money. He'd also designed his own type of surgical procedure which hadn't been researched properly. And his punishment was very tough. It was 15 years in jail. The next one you may have heard of, quite recent, kind of unbelievable, but there was a liver surgeon recently who was apparently a very good surgeon who was doing liver transplants, and before he closed up the patient he would get an argon laser, which is what they use to cauterize blood vessels, and he would sign his initials on the patient's liver and then close the patient up. Apparently a nurse spotted him doing this one day and said, "What are you doing?" And his response was, "It's just what I do." So straight away there's an arrogance there and an ethical dilemma, and the nurse, full credit to her, probably should have whistleblown at that point. I think what happened is that a patient went back to theatre for a second operation, and another surgeon opened up the liver recipient and saw the initials and realised what had happened. And this guy was sentenced to a 12-month community order. It's a very interesting case, and it's worth having a look at what he was actually found guilty of. It's also quite interesting because there were patients interviewed at the time who said, "I don't care if he autographs my liver, he saved my life." But it goes deeper than that. He was doing things for which there was no medical reason. So there was an ethical issue here, but it is an interesting case. One of the big ethical dilemmas that rears its head every few years is assisted suicide or euthanasia. This guy here is an American pathologist who got the unfortunate nickname of Dr. Death. His name was Dr. Kevorkian, and he had his own portable system to go around to people to help them to die. He believed strongly that the patient had the right to die, and his mantra was that dying is not a crime. Unfortunately, it is a crime to help someone to die, and he had helped about 130 people. He was eventually convicted of murder in 1999. He was specifically arrested in 1998 for his role in the case of a man with Lou Gehrig's disease. Now, Lou Gehrig was a famous American baseball player who got this disease, which is a little bit like what Stephen Hawking had. It's ALS, which you may have heard about, the Ice Bucket Challenge a few years ago. It stands for amyotrophic lateral sclerosis. So he was found guilty of murder and served 8 years. He was released on the condition that he wouldn't promote his views or talk about his views or do anything to assist suicide of patients in the future. The other big thing now that we need to confront is genetics. So obviously in the past 20-30 years we've understood much more about genetics, the human genome and DNA, and that's creating a whole load of ethical dilemmas now. Just wanted to talk about the phenomenon of the 3-parent baby. So you recognize this picture of a mitochondrion. A mitochondrion is the part of a cell that produces energy. There is a disease called mitochondrial disease. There are several of them, but you can imagine that if you can't produce energy, you're severely limited, physically, emotionally, developmentally, and it's a genetic disease. Now this is quite complex, so bear with me, but you know that the DNA of a human is found inside the nucleus. Inside the cytoplasm is the mitochondrial DNA, and that's passed down from mother to mother. So if you have a child who is potentially going to be born with mitochondrial disease, the egg that they come from has a normal nucleus but abnormal cytoplasm, and it's going to be fertilized by a normal sperm. So what you do is you get 2 eggs, one from the mother and one from an egg donor. In the donor, you take out the nucleus and throw it away and keep the cytoplasm, which is normal. You then take the nucleus from the mother of the child who could be carrying mitochondrial disease, and you inject the normal nucleus into the donor normal cytoplasm. So you end up with 1 egg from 2 women. You then fertilize that with a sperm, and if that grows to an embryo, you then have an embryo which has got 3 genetic parents. Now 98% of the DNA comes from the biological parents, 2% comes from the donor. So that straight away creates certain problems. Does that mean that when the child grows up, you're responsible for 2% of its university fees, which is obviously ridiculous? You'd have to sign a waiver to say that, you know, I accept that this is not going to be the case. That's why, with fertility treatment, consent has to be written down, because it's such a minefield. One of the issues here is that we don't really understand what the link between the mitochondrial DNA and the nuclear DNA is. So we've now got a load of children who are growing up, and we don't quite know yet what the impact's going to be. I have a friend who's a geneticist, a consultant geneticist, and she says that they are now seeing more children being born with birth defects who are the product of things like this. But this is now been given ethical approval. Just have a think about how you feel about this. I'm not suggesting that it's right or wrong. Another thing that I thought was interesting is the whole thing about where does our DNA go and who has access to it. So a couple of years ago, I sent off a saliva sample to find out where my ancestry came from. And it's quite interesting. And every few years I get an update about where it's come from. And as you can see, I am partly British, partly Icelandic, and partly Norwegian. That probably accounts for my stunning Nordic good looks. I just wanted to say that on the record. But there's a double edge to this sword. If I now cause a crime or do something bad, who has access to my DNA profile? And there was a case recently in America where somebody was convicted, and I think the FBI actually contacted a DNA database and got the profile. And that's quite interesting. I don't know whether that's actually legal or not. So if you watch crime programs, what they'll quite often do to get a DNA profile, if the criminal or suspected criminal doesn't want to give a DNA profile, they will offer them a cup of tea or coffee or a drink, wait for them to take a drink, and then take the cup, which is then in the public domain, and they get a sample from that. Or they'll take your trash from your home and try and get a sample from fingernail clippings or something like that. So I just got to be really careful now, and I can't kill anybody, I'm afraid, which I wouldn't do anyway. Okay, so we're into one of the bigger ethical dilemmas now. Around about 2015, an Italian neurosurgeon said that he was ready to do the first ever human head transplant. And this is the guy, his name's Dr. Sergio Canavero. He actually has a person who is willing to have the surgery. It's a young Russian man with a muscle wasting disease, which is probably similar to ALS. I just thought that was a really interesting dilemma. Have we taken things too far? At what point is it unethical under any circumstances to do a head transplant? If we'd have been having this discussion 50 years ago, we would have probably said it's unethical to do a face transplant or a skin graft from a dead body or a liver transplant. But now we kind of think of those as fairly normal. And I've certainly taught people who've benefited from stem cell grafts and stem cell transplants. So I don't know what the answer is, but I just thought it would be worth thinking. So you're sat on an ethics committee and this comes on your desk. What do? You have to make a decision quite quickly. Do you grant ethical approval or not? And I suppose it comes down to this. Do you view this as progress and we should support progress in science and medicine, or this is wrong and weird and we can't do it? I don't know what the answer is. If you want to discuss it with me sometime, I'd be happy to do so. But I hope that you found this presentation useful. Thank you.